and welcome to our new series, Ready for Winter. This is going to be a series of webinars to help prepare our members for the winter months and what they might be experiencing once we don't no longer have outdoor seating and once cold and flu season starts ramping up on top of coronavirus. First of all, I'd like to thank our sponsors, United Healthcare Group. If there is anyone here online with them, thank you very much for your sponsorship. And some other housekeeping. If you have any questions for our speakers today, you have a choice of clicking on the Q&A. If you want to go ahead and do that, we can get your question, type your questions in there, and we can get them asked. First of all, this morning, I'd like to make introductions. I'm Lisa. I'm with the Washington Hospitality Association in the Communications Department. And with us this morning, we have Samantha Louderback with our State Government Affairs team.
Good morning.
We also have Mark Springer. He's an epidemiologist with the Spokane Regional Health District. And Doug Dyer, who is a health and environmental investigator with Public Health of Seattle and King County. So first of all, Samantha, would you like to give us an update on the latest from the Department of Health at the state level?
Great. It's perfect timing, actually. Yesterday, the Board of Health just voted to adopt the newest food code that the association and a food safety group made up of some of our members has been working on for the last 2 years. Good news is we were able to convince the Board of Health that, implementing that rule right now is probably not the right time. We need to focus on education with all the changes. And so that new rule, the new food code, will not go into effect until March 2022. So we're going to have some time to help educate once some things calm down there. So I think that's the biggest update that you all should know about from the Department of Health and the Board of Health.
All right. We do have one quick question. That this looks like it's starting off with the coronavirus questions. So Mark, why don't you go ahead and introduce yourself, and can you tell us a little bit about what's the difference between coronavirus and the flu, the difference in symptoms?
Sure, I can do that. So flu, I mean, we're all pretty familiar with. It's usually what we look at from a public health perspective. It's usually a high fever, greater than 101, and then people will have cough or sore throat. Oftentimes what distinguishes flu from the common cold is we have those body aches and that sense of fatigue as well. So those are the kind of the hallmarks of flu. When we look at coronavirus, it does have some of those respiratory symptoms, so there's a lot of overlap. We still have high fever, we have cough, sore throat as symptoms, but we also have other symptoms in terms of shortness of breath or difficulty breathing. We have symptoms that are GI related in terms of vomiting or diarrhea. We have some symptoms that are very important but a little unusual for respiratory illnesses, and that's kind of a loss of taste or smell. That loss of taste or smell is very unique to coronavirus. And if you see that with any of your staff, that would be something to assume you're dealing with coronavirus until you have test results showing otherwise. But there's a lot of overlap between the two.
Okay. Based on the data that you guys are seeing now, how long is everything supposed to come? All right, how long is this going to last?
So if we look at kind of the data that we have, I mean, I think nationally, I think we're looking at, maybe 10% of the population who's been infected by coronavirus. To get to some level of herd immunity, that's going to be 50 to 70% of people who are protected in some way by vaccine or natural infection. We hope to get the vaccine sometime, earliest reports are, maybe December, but it could be January, February, March, sometime in early spring where we see vaccine becoming available. And then that's going to be probably prioritized to groups that are high risk. And I think it would probably be 6 months plus before we get the vaccine throughout the community. So I think it's reasonable for us to look at, for at least the rest of this year and early spring, we're going to be dealing with much the same thing that we're dealing with now, with coronavirus activity being present and our response and mitigation efforts being in place. We may see some changes, with vaccine getting out as we get to late spring and summer. But I think we're still going to have some effects with this, with our businesses, going into fall of next year. I think that's a reasonable look forward.
Can you explain to us how an asymptomatic person can easily spread this disease?
Sure. So if we look at situations with asymptomatic infections, we think that happens about 40% of the time with coronavirus. And even with people who are symptomatic, they can spread the infection up to 2 days before their symptoms start. So, there's a significant amount of risk for people without symptoms. And that's part of the reason why we have that focus on physical distancing and facial coverings, because that's going to protect us, when we don't have any indication that we're infected, when we're, before we develop symptoms. So it's a big part of our risk with coronavirus and transmission in settings.
And how does contact tracing work? How fast are you seeing everybody get involved, getting informed that they may have been exposed at this point?
So right now in Spokane, our turnaround times for testing for if someone thinks that they have coronavirus, there's some rapid testing for people who have symptoms, but most of our testing is maybe about a 2 or 3 day turnaround time. When that test result comes back positive, the employee will hopefully be contacting their supervisor to let them know. We will usually get a notification from the laboratories within 6 to 12 hours after the patient gets the initial notification. And then that person is assigned for case investigation and contact tracing within 24 hours. And we hope to have all of those contacts identified within 48 hours and notified. So that's the goal. And we've been pretty good about being able to reach those metrics.
We have a question from the audience. An employee's spouse got a positive coronavirus test yesterday. She's been tested with no results yet and will voluntarily quarantine for 10 days past her symptoms. Can the employer request or require another exposed employee to be tested?
So you can request that. Generally, when we're talking with people, we recommend that all household contacts and close contacts get tested 5 to 7 days after their exposure, because we do know a lot of people don't have symptoms, and we want to make sure that we identify them. If they're in a household like that with a spouse, they would be quarantined for 2 weeks past the last date where their spouse was infectious. So they would be out a minimum of 2 weeks, maximum of maybe 24 days.
So Doug, can you tell me a little bit about what you've been doing in Seattle with temperature checks, teaching everybody the right way to sanitize? What are you doing over in King County?
Sure. So starting in about late June, early July, Public Health Seattle, King County, through a directive from our executive's office, created what's called a Safe Start team. So what our Safe Start team does is we do outreach with our licensed food establishments, and we're focusing primarily, although not exclusively, on the highest risk level. So that'd be full service restaurants. Typically they might have a bar integrated into them as well. And so what we're doing is we have teams of 2 go out and basically we do a site visit. And what we're looking for lack of a better term, is we're looking for compliance with the governor's Safe Start guidelines for phase 2 in our county. And I understand it could be phase 3 in other counties throughout the state of Washington. And so simultaneously, what we've been doing also is trying to provide as much information in a variety of methods as possible to those operators. So we've worked with our county's business outreach group to have webinars just like this. We've tried to put as much information on our website as possible. We've produced videos. As you can imagine, there's a multitude of languages spoken within King County. So we've also created information in well over 15 different languages. And so what our teams do is they go out and they do an assessment based on 9 areas, which are really, foundationally in the governor's Safe Start guidelines. And so if there is an observation where, for example, a food worker might not have a face covering on, then our teams work with the operator more within the realm of education and not strong compliance, to make sure that the operator understands what their responsibility is for abiding by the guidelines. And if they need resources for that, then our team can provide that. And resources can be print material, of course, interpretation, whatever it takes to help folks understand and do the best practices possible to minimize the potential spread of COVID-19 in food establishments. So that's a big part of what we've been doing. But then also, from just the regular regulatory food inspection standpoint, it became real challenging because the executive's office at King County also put restrictions on us actually going out in the field and the time we can spend on the field. And certainly if you were in a high-risk category, you weren't allowed to go out in the field. And we have staff who meet that classification. So we created a virtual food safety assessment program where we utilize digital technology in the form of like Skype or FaceTime to actually set up an appointment with an operator and do a virtual walkthrough food safety assessment and really focus on some primary foodborne illness risk factors, demonstration of knowledge when it comes to employee health and hygiene by the person in charge, manager or owner of the facility, and then walking through and doing some temperature checks and reviewing other things like when to exclude ill food workers. Do you know what the symptoms of COVID-19 are, and do you screen your staff before they start their shift? So we're kind of on 2 fronts, helping operators as much as possible under some, a fairly difficult situation, because we're used to, our profession's really interpersonal. I mean, we're used to being in the field and talking to people and doing, routine inspections and that sort of stuff. So this has put a bit of a challenging twist on that. But at the same time, we've heard some pretty positive feedback from operators that they felt like it was really important that we came out and helped them and help them understand what these guidelines mean. Because for us, we don't have any information ahead of time when the governor releases something. So, or when the governor's office does. So on October 6th, when there were some updates to phase 2 and phase 3, like additional persons allowed at a table for indoor dining, getting rid of that requirement that everybody had to be from the same household, expanding alcohol service to an additional hour. Like, we literally found out the same time all of our participants on this Zoom call found out. So that's been a challenge, but we try as much as we can to get timely information out to folks, and we're getting some good feedback. And when we're doing our STAR assessments, we're finding compliance rates, certainly for face coverings, certainly for understanding symptoms, determining whether or not they're actually screening employees, social distancing, not exceeding a maximum of 50% if you're in phase 2 for indoor dining. We're getting compliance rates usually in the mid 80 percentile. So that's pretty good when you think about that. I mean, we've literally had to build a program within a couple months and get out there and help folks. So we thank our operators for helping us with that. It's extremely important, and I don't think I can stress enough how important it is, those foundational behaviors for minimizing the spread of COVID-19 among staff in food establishments.
One of the attendees has identified a handful of people who dined and were in close proximity to a coronavirus positive guest. Is there a sample letter we can use to make sure we meet notification requirements without causing undue alarm? And this could be to either Doug or Mark.
We do not have sample letters for notifications other than kind of in schools and other specific settings like that. I'm not sure what King County has for resources there.
Yeah, I'm not aware. I work pretty closely with in our communicable disease epidemiology department. There's a workplace investigation team, which works with with all workplaces, not just food establishments. If there is some significant spread of COVID-19 among staff, I can certainly reach out to them and ask them. I'm not aware, and I know we haven't. We in our program, environmental health.
Hey, how do I know when my employee is just sick or just tired? What's the difference between fatigue and just being tired? This is for either of you.
So, fatigue is going to be something that's out of their normal. A lot of times if people are working long shifts or they have kids at home and they're dealing with a lot of things, they have a good sense of their energy level. But this would be something unusual. Usually, it's going to be associated with some other symptoms. But the issue that we want to have employers look at is that even if you have one of these symptoms, you can have coronavirus. We're dealing with this issue in our schools, and people are being sent home with just a headache or just congestion and testing positive. So if they're having some symptoms and you're not sure, send them home, have them go to a provider and get tested. If they have a negative test result, they can return within 24 hours of their fever resolving, or as well as their symptoms are improving. So it's at least in Spokane, our testing is pretty good in terms of fast turnaround times, and I would err on the side of caution rather than having some kind of a spreading event with your employees, or even worse, with your guests.
What are the best recommended screening practices for employees?
I would say, so it's been interesting working with operators the past few months, is I've learned there's a couple different ways. Like some of the big corporate entities that have the technology resources, for an employee, for example, starts their shift, they may go to a, like a desktop computer or a tablet or something, and they go through a series of questions. So the questions basically ask, do you have these symptoms? And I think that is a good way to initially get people thinking about what their personal responsibility is coming into the workplace, making sure that they're not symptomatic. But what I found for the most successful places where they seem to really sort of spot on, have good overall control in this area is a redundancy in also having a shift manager or manager on duty ask the questions again. So it's actually becomes kind of redundant, right? So the person comes in, they're getting ready to start their shift, call it clocking in, I guess, go through a series of quick questions about your personal health. And then the manager follows back up and asks those questions again. And where this becomes particularly important is if there's multiple languages spoken in a restaurant, because you may not be able through technology to actually be able to ask a person the questions or get the information in a manner that they best understand. And with verbally asking, you can sort of get through some of those interpretation issues and nuances of communication, just to be sure and have a higher degree of confidence that employees come in and certainly aren't symptomatic prior to starting their shift. So that's one that I think I can't stress enough, is just really good foundational training for staff. So other businesses I've worked with, they'll do huddles, and I bet most of the folks on this Zoom webinar probably have huddles or staff meetings or some form where you can disseminate information out about what symptoms are, make sure folks understand those symptoms, and making sure they understand that they need to communicate those to their manager or person in charge before they start their shift.
Just one additional update, the Department of Health has updated their screening criteria this week, and I sent or put a link in the chat with that new document, which kind of divides up some of their symptoms into what I think Class A, Class B, kind of major symptoms or minor symptoms. So that's available for you in the chat.
One question we have from attendees are, can you recommend where employers can direct their teams to go and get free testing? I know it's probably different in King County and Spokane County than it is in the other outlying areas, but in general, where's the best place to direct employees for tests?
You know, I would look at your community's public health website. I know with ours, and I'm sure with King County as well, we put locations for community-based testing, especially those that are being offered by public health. And that also has some other resources, you know, in terms of times and, you know, which type of tests are offered, whether those are rapid tests or, you know, the PCR tests that usually take 2 to 3 days. So at least from our perspective, we would want you to consult our website because that has the most up-to-date information.
Hey, Lisa, I just threw a link in the chat that was on Department of Health's website that goes by county of where you can find those locations. So I just put that up in the chat for everyone.
Thanks. Okay, let's see. Somebody is asking, can you please restate what the recommended quarantine is for those who have no symptoms themselves, but live with someone who has symptoms, but has not been diagnosed with coronavirus yet? Unless a doctor releases them to return to work somehow, do they have to quarantine 14 days from the time when the person in their household has resolved symptoms, or is it a different time frame?
So you can't really test out of quarantine, you know, or get a doctor's note. If you're a close contact, you could develop coronavirus infection at any point in the quarantine. So the quarantine is 2 weeks, and that's from the last date of exposure or the last time their household member was infectious. So if this is a situation where you have a household member who can effectively isolate in the home, you know, they can maybe be in a basement apartment, maybe it's a roommate, then they can go from 2 weeks from the last exposure to the roommate. If this is a situation where the person who's positive is a young child, where you can't effectively isolate yourself from your child, or a spouse, then it's 2 weeks from the last date of exposure, which is when that person was infectious, and that's effectively 24 days from the onset of illness of the person who's positive. It's a little bit algorithmic, I know, but you know, just usually think about 2 weeks from the last potential exposure.
Now that people are wearing a lot of masks, do you have updates or modifications to close contact rules with mask wearing? For example, if all parties are wearing a mask, then can contact be closer than 6 feet, or for more than 15 minutes, or for an hour or more? Any recommendations for the most effective kind of masks? And are the disposable 3-layer masks better than the homemade cotton 2-layer masks?
Well, I'll just touch base on the close contact and leave Doug for the mask question. But
okay.
Generally speaking, unless you're wearing medical grade masks and have, you know, the appropriate protection that would be more seen in a medical environment, that if you're under 6 feet for more than 15 minutes, we consider you a close contact, regardless of wearing facial coverings. Those facial coverings are going to decrease the risk of developing coronavirus, but if you're In that proximity for 15 minutes or longer, you're going to be considered a close contact. So really, masks are for reducing risk, but the physical distancing is the most useful for preventing quarantine.
Yeah, I would just reiterate that we're not so from a King County perspective, we're just basically we've framed it as a face covering. So for licensed food establishments, for example, we're just looking for a face covering. We're not requiring a specific type of face covering, but that's in combination with, as Mark stated, physical distancing. So that's extremely important. So when we do I mentioned our STAR assessments earlier, that's really what we're looking for is, and the challenges for food establishments is, how do I need to change my business and operational model to make sure that I can maximize physical distancing, particularly among food workers in food storage and handling and preparation areas. How am I going to change the way I do things so that I can maximize physical distancing and not have food workers in close proximity to each other for prolonged periods of time? So the mask is another protective factor, but that's with distancing and hand hygiene and monitoring personal health and screening. So, it's this combinatory effect of doing all of these things that really help with risk reduction. I know the Washington Department of Labor and Industry classifies different types of jobs and therefore classifies personal protective equipment associated with those jobs. We, as a health department involved in regulatory food safety, have not gotten into that level of detail on face coverings. However, I know L&I has the right to go in and investigate any type of business, and may go into a food establishment and, based on a complaint, for example. I don't think they just do routine inspections necessarily but I think they respond to complaints. If an employee complained, for example, about their employer, and they may have a different take on it. So what may be worthwhile in the future, if for another potential webinar, is to have a Washington Department of Labor and Industry representative for these kind of questions. But I will tell you, from our standpoint, we're looking for a face covering.
Hey, Doug, while we're talking about the STAR report and going in, you said that King County food establishments are at a mid 80% compliance rate, which is fantastic. We do know that these rules and regulations have changed over the last 7 months at a rapid rate. And so it kind of takes our members and us, quite honestly, to understand the new changes and what it looks like. What are the two top things that you are seeing in King County that we should really think about as operators to focus on compliance?
Sure. So I'm looking at a separate document here of a breakdown of things. And I think probably the most difficult ones, the one that kind of has the lowest rate, I would say, of, I don't know if compliance is the right word, but probably understanding and practice, is this whole idea of contact tracing information and how do I broach voluntary? So we know that we know early on the governor released some language about patrons providing contact information for contact tracing. That was challenged and the language changed early on and it became voluntary. And so what restaurants, I think, are confused about, and to a certain extent I can understand this, is, are they required to still ask someone for their information and the person is only voluntarily required to provide it? Or is there another method they can use? And none of that has really been delineated. Therefore, it's hard for them to understand that when, and this is not necessarily a top priority question for us versus looking at these other behaviors like mask, face coverings and distancing. But I think it's been a challenge, one, for us to understand what the intent of the governor's language is, and two, for operators to have solid examples of what they can do to inform a person that the information that they can voluntarily provide information, because many restaurants, it's sort of a passive approach. They're waiting for the customer to say, oh, I know about contact tracing and I can voluntarily provide my name and phone number. So here it is. Well, then you're required as a food establishment to retain a log of that information for at least 30 days, right? And so many people have a way to log that information, but the logs are empty. So I think that's one, and hopefully I'm not being too complicated or confusing here, but I think that's one that's been a real challenge. So therefore, we've tried to, we've reached out, we've had our executive's office reach out to the governor's office to try to get some clarification. Haven't really received anything yet on that. I know the state health department food safety team, who Samantha's familiar with, like Joe Graham is the supervisor and Susan Shelton and so forth. I believe they've tried to reach out on this topic. I've not seen anything come across to us as local health jurisdictions on that. So that's definitely one. And then let's see, another one is the rest are pretty much in the 80s. Of those in the 80%ish, 80 to 90%, employee screening's lower than the other ones, like distancing and seating capacity and other guideline stuff. So, much like routine health inspections where you're talking to the person in charge about what their responsibility is, this is kind of the same thing. So it's really just making sure that comprehensively there are people in management at food establishments that have a good working knowledge of symptoms, have a good method for asking employees if they've experienced symptoms before starting their shift, and then knowing what to do if the employee says, yeah, you know what, I woke up this morning and I'm experiencing A, B, and C, and those are symptoms that are consistent with COVID, and that means having the food worker not work and do the necessary isolation if they're symptomatic. So
Great, thank you.
yeah, for sure.
Within the next six months, how likely is it that employers will be able to purchase rapid testing equipment to proactively screen their employees?
I've not heard any conversations, certainly from our public health folks or our county health officer, Dr. Duchin, on that topic.
For Spokane, I think the only areas where we are seeing employers purchasing lab testing supplies have been our universities. At this point, I think it's more financially insurmountable for other groups.
What are the best thermometers to use to screen your employees in the morning? Are we finding the forehead or the wrists? Do you have a thermometer that you would recommend?
So I don't recommend any particular type of thermometer. Analogous to food safety, whatever you use for a thermometer, just make sure that it's accurate and calibrated frequently. Now, if someone decides to use an infrared thermometer to do a forehead temperature, I don't know what the calibration for that is, but if I'm not mistaken, it's not required though to take a temperature. Is that correct, Mark?
You can go with subjective fever as well.
Okay.
With the criteria.
Yeah, the way that I read the guidance is that taking a temperature is not required. However, you do need to screen in some fashion. So those were all the very in-depth questions come in.
Yeah, I think what our STAR team has found out in the field is oftentimes some choose to take a temperature, but oftentimes they'll ask an employee, have you felt feverish, or do you feel like you have a fever? More that sort of, I guess, subjective question and response kind of thing. So I'm just, with thermometers, I sort of, through personal experience with food safety, the caveat is always the thermometer is only as good as the calibration. So I think that's an important thing to bring up.
When should employees get a flu shot?
So flu shots are available now in most communities, and so flu season, typically we start seeing flu cases in late October, November. For Spokane, that tends to peak in January, February. And so we would recommend getting a flu shot before flu season starts taking off. And so for most folks, we would recommend getting their flu shot sometime in October. But we wouldn't. We would still encourage it if they haven't gotten it in October, in November, December, January, because flu activity is, that flu shot is still going to be beneficial because of our season going usually through March.
I realize you can't test out of quarantine, but can a doctor release you to work before your quarantine time is up?
Generally, we don't acknowledge a doctor's option for releasing someone from quarantine. That's a public health measure. They can do other things, though. So if a person has symptoms, they can certainly release that person if they've had no exposure, based on a negative COVID test, or they can write a doctor's note and saying, this person's headache is because they have a normal history of migraines and is not reflective of COVID. So physicians can, write a note to get a person back to work. But if someone's truly been exposed, we don't want that person back at the work site because of the risk of exposing other people while they're asymptomatic.
Okay, and the last question we have here is the 15-minute per contact per day per 48 hours for contact tracing purposes?
Yes, it is. So that's how we identify close contacts, would be looking at, someone who had close contact, for over 15 minutes and, under 6 feet. So usually that's going to be household contacts, but in work settings, there's sometimes office and other areas where close contacts are occurring.
Okay, and I think my last question is for both of you. If there is one takeaway you would like our members to know about coronavirus or testing or screening, what would that be?
I would just encourage food establishment managers, supervisors to just really, to the best extent possible, just really keep your staff informed about what the symptoms are. Make them feel comfortable approaching you if they're not feeling well. Implement a good screening program to make sure that they're screened before they start their shift. And by all means, reach out to your local health jurisdiction. So I realize we may have folks from across the state of Washington. So I'd really encourage you to develop that relationship with your local health jurisdiction in order to ask questions, look for resources. We welcome folks, of course, anyone can check out the King County website, but keep in mind, different parts of the state may be in different phases at any given time. So a lot of what we're going to have is going to be phase 2 type of stuff for King County. That's kind of where we're at. But I would encourage you to really develop that relationship with your local health department.
I would echo what Doug said. You're going to have different situations when you have someone who's positive and with your staff, or if you had an exposure in your business. And reach out to your public health folks for advice at that point. There's a lot of options that are constantly changing in terms of what's available for testing and other resources. So reach out to public health and we'll be able to get you some advice and hopefully some help.
Okay, are employees that have tested negative required to quarantine for 14 days after their exposure to the infected person?
Yeah, so if they're a close contact, the negative test only gives us a point in time. We know they're negative when they had that test collected, but they could still develop the disease and be infectious after that. So even if they test negative, they still need to continue their quarantine and finish out their 14 days.
Is there a requirement of how big the social distancing panels should be between tables or employees working in a small area in the back of the kitchen?
This is a tough question because again, with the guidelines, when the whole language about barriers was released, it never gave a performance standard for what a minimum barrier looks like, right? So I think Washington Labor and Industry came out with an opinion recently about at least 6 feet high, but I don't know that it talked about width at all. But here's what I would tell restaurant operators. So let's say you have back-to-back booths. Imagine like a restaurant like an IHOP or something where you have, I think they have back-to-back booths, and then there's a space, right? There's kind of that space there. I would say putting up, so from the floor to the top of the barrier, probably a good height to shoot for is about 6 feet. So when you think about the average height of a human, and you think about like sneeze guards on buffets and stuff, those dimensions for sneeze guards come from FDA recommendations based on the average height of a human male, I guess, being 6 feet. So I apply that when operators ask about, what's a good height? Well, the good thing with booths is people will be sitting, right? And they'll be facing each other across the table. So if they coughed or sneezed, with barriers that are at least 6 feet high between those booths, that's probably sufficient. And then, sufficiently wide to just be spaced in the gap. That's probably, although not a guarantee, at least a barrier that's going to inhibit, hopefully, any airborne virus from affecting folks in adjacent booths. But unfortunately, there's not a clear standard when it comes to dimensions, because some other things now that are really starting to be talked about seriously are the mechanical system within your space. So think about your fresh air, your makeup air, the amount of air that's turned over. Back in the kitchen, think about hoods over your cooking equipment. So now the big recommendation is make sure, to the extent possible, that your HVAC system is maintained and operating so that you're getting the proper air turnover. But that may entail working with someone who's an expert in that area, or reaching out to a local building official who would be a regulatory expert in that area for specific questions. Most of us in the public health, environmental health world, we're not mechanical experts. We just can tell you generically, you need to have a good, you need to maximize your HVAC system. That doesn't mean a lot when you're looking for specifics, but that's also, I think, an important factor here, is certainly as more information comes out about how this virus interacts with air. Once it's expelled from a human, for example, how long does it linger in the air? And there's probably a lot of what ifs. What is the temperature and air turnover, and all these sorts of things. So that's kind of deviating a little bit from the question of barriers, but I would say barriers in combination with a well-working ventilation system definitely are a benefit. And it's case by case. So each restaurant is unique, right? For the most part, unless you happen to be a large corporate chain in which it's the exact same footprint everywhere you go. But I mean, most of us know that restaurants are unique, and they're unique spaces, and the way the seating is set up is unique. So, barriers aren't necessarily a substitute for physical distancing, but in some cases we understand things can't be moved, therefore a barrier is going to be needed.
All right. Well, I want to thank you both so much for your time and all the useful information that you've given us today.